Hey everybody, welcome back to the YouTube channel Mental Matters More. I'm Amanda G, Psych NP, and this is the channel where we discuss all topics related to mental health. Today I wanted to talk about something called borderline personality disorder. You may have heard of that, you may have not, but it's a cluster B personality disorder. And I wanted to talk about ways to recognize it, treatments for it, and how to navigate this disorder, which can be difficult for both the individual and the family. In mental health, borderline personality disorder kind of gets a bad rap. I have clients that even say, hey, I think I have BPD. They don't even want to call it borderline personality disorder because it does have a bad rap for a few reasons. Criteria for diagnosing borderline personality disorder includes extreme emotional ups and downs, roller coasters in a 24-hour period. They have feelings of worthlessness, insecurities. They have impulsive, reckless behavior, which a lot of times includes self-harm, cutting, picking, burning. They have an intense fear of abandonment, and they just have a very labile mood, which obviously makes it really difficult for them to have relationships at home and socially. Like many mental health disorders, borderline personality disorder oftentimes starts in the teen and adolescent years. And one of the good things about it is that as the individual gets older, it usually gets easier for them to navigate their intense emotions or feelings. So usually we don't see borderline personality disorder lasting much more than about our 20s and 30s. By that time, the individual has developed some coping skills and has kind of figured out how to navigate their intense emotions so that they can function both personally and professionally. Some individuals may have an inpatient stay at a hospital for the self-harm behaviors that I mentioned, cutting, picking, burning. Most often, these behaviors are not a true suicide attempt. They're not meant to take their life. They're a coping skill that is obviously a negative coping skill. I've talked about that in other videos you can take a look at. But it can land them in the hospital for an inpatient stay. And it's really important that we take their self-harm behavior seriously because they could accidentally hurt themselves further than they actually wanted. And that's where the risk really lies. So it is important to address the cutting, picking, burning behaviors. Borderline personality disorder does not have any FDA medications that are actually approved just to treat that disorder. However, we can treat the symptoms. Oftentimes, anxiety, depression, psychotic behavior, irritability goes along with the disorder by nature. So we can use medications to help the individual navigate their emotions while they're also doing therapy. Therapy is going to be a really key component for treating this disorder. And the good news is there is a therapy developed specifically for borderline. It's called DBT, or dialectical behavior therapy. It was invented by Dr. Marsha Linehan, who has recently come out and described her own struggles with borderline personality disorder. So this therapy is amazing and I love it. We can use it with other disorders also, not just BPD, but anxiety, depression, phobias. And it really focuses on four major aspects: interpersonal relationships, distress tolerance, mindfulness, and emotional regulation. So it's a great therapy. I use it frequently when I'm working with clients that have BPD and other disorders. Here is the workbook. It's kind of the DBT Bible that we use. And I will put the link for this in the description below. So there are other workbooks that are also really helpful when trying to do the therapy at home, and also if you're working with a therapist, because like anything, practice makes perfect. So if we're using these skills that we're learning every day, it's going to help us better to be able to apply them when needed. Okay, here's a secret. Providers, really good providers, have usually been patients. So like with the DBT therapy, Dr. Marsha Linehan definitely upped her street cred with me when she acknowledged just a year ago that she was a borderline personality disorder sufferer and was able to treat her symptoms successfully with dialectical behavior therapy. So just something to think about. Okay, it is true. BPD can be difficult to navigate for the individual and the family, but by using some of the techniques and the medication management and the therapies that are proven to work, you can get through it. Okay, time out. I know firsthand that borderline personality disorder is really difficult to deal with when you have an individual living in the home that is suffering from this. It's difficult for the family, it's difficult for the siblings, it's difficult for everyone. But I will say, It's most difficult for the individual that is suffering from BPD. So love, tolerance, acceptance, learning about this disorder, practicing those DBT skills at home is going to be key in helping them. And you can get through it. It gets better. I promise you can get through it. Thanks so much again for tuning in to Mental Matters More. We were discussing borderline personality disorder. I hope you found it helpful, informative. If you have any questions or comments, go ahead and put them in the link below. And I will look forward to making videos for you guys again. I want to talk about topics you want to hear about, so go ahead and let me know. Subscribe to the channel, and I look forward to talking with you soon.